Hi everyone, this is Dr. Anurag Kumar, and today with this video I will tell you about the toxicology part. Every year UPSC is asking around 3 to 4 questions from the toxicology part. So I will cover all the topics which are very important, which are asked repeatedly, and if you will cover those topics, then you will be able to at least mark 75% of questions right from the toxicology part only. I will be covering 6 to 7 important topics. Questions mostly वहीं से आते हैं. So our first topic is going to be gastric lavage. आज का वीडियो मैं बहुत क्रिस्प रखूँगा, बहुत ज़्यादा टाइम नहीं लूँगा. गैस्ट्रिक लवाज में there are some important points, like it should be done within 1 hour and it can be done till 4 to 6 hours. Best is if it is done under 1 hour, and we take fluid that is according to the weight, that is 5 ml per kg body weight, and patient should be in left lateral decubitus position. Now important things are that what are the contraindications for gastric lavage. So we will remember it by 4C. First, corrosive, and that is strong acid and alkalis, and second is convulsions, and third is comatose condition, and fourth is kerosene. You can remember it by kerosene. Okay, mostly they ask about corrosive and kerosene and other petroleum products. Our next topic is pinpoint pupils. So this you can remember by O to P2. First O, organophosphorus and carbamates. Second is opioid, and P, first P is for pontine hemorrhage and second P is for phenol, that is carbolic acid. Our third topic is organophosphate poisoning, or we generally study organophosphate with carbamates. So these both things, they inhibit acetylcholine esterase in synapses, which leads to further increase in acetylcholine amount and causes the excessive cholinergic system activation. For examples, they can give you malathion and parathion, like these substances. Now what are the symptoms? First is the patient will come with kerosene like odor. Increased secretions will be there, like salivation and lacrimation. You will see the pinpoint pupils, and patient may be complaining of blurring of vision, and other complaints may be diarrhea and vomiting. The next thing is how to treat. So basically, for organophosphate and carbamate, one thing is different, that is that we do not use oximes in carbamates. Okay, first thing this, and the second thing is that atropine is the drug of choice for these both poisons, and oximes help in regeneration of acetylcholine esterase, while atropine reverses the muscarinic symptoms, deals with all the muscarinic and nicotinic symptoms. Oximes help in regeneration. Our next topic is snake bite, which is very important. Every year they are asking around one question, at least one question they will be asking. So there are basically two type of snakes. One is Ellipidi and second one is Viperidae. So Viperidae and vipers, so we will remember it by 3V: viper, Viperidae and vasculotoxic. So Viperidae snakes are mainly vasculotoxic, and Ellipidi, and which are sea snake, cobra and krait, in which sea snake is myotoxic and cobra krait both are neurotoxic. So according to their toxicity, the symptoms will be there. For suppose if the snake is viper, that is vasculotoxic, you will be seeing the complaints of bleeding, like bleeding from orifices like nostril, mouth and all. And if the snake is neurotoxic, that is cobra and krait, you will be seeing the complaints of convulsions, paralysis and eye drooping, mainly motor symptoms. And if the snake is sea snake, then it is myotoxic, so you will be seeing the terms like rhabdomyolysis, flaccid paralysis and myoglobinuriria. So for diagnosis, we do 20-minute whole blood clotting test. One test we also do, that is single breath hold count. That is mainly for the complaint of respiratory distress. 20 WBCT is done mainly for Viperidae bite, and as single breath hold count, that is done mainly for neurotoxic, that is cobra and crate. So what are the things which you should not do after snake bite? There are 4 things which you should remember. First is reassure. Second is pressure immobilization you must do. That is only for leopards. For vibrates like vipers, we do not do pressure immobilization. And third is immobilization. And fourth is you should not manipulate the wound. And yes, you should not walk, and you should not like excise the wound. You should not just stick any foreign body in the wound. You should not suck the wound, like these things. So how do we manage? One thing we know, that is anti-snake venom. We give 8 to 10 vials IV over 1 hour, and we have to repeat after 6 hours if needed. If the symptom persists after 6 hours, then we repeat 8 to 10 vials again. Our next topic is paracetamol poisoning, which is also known as acetaminophen poisoning. Clinical features will be nausea, vomiting, abdominal pain, diaphoresis, confusion, arrhythmia, and coma can also be there. So the treatment modalities are: first, the primary thing is, as a patient comes, we should do gastric lavage. As we know that gastric lavage can be done till 4 to 6 hours, then it is better if the patient comes within 4 hours, you must do the gastric lavage. And the antidote is N-acetylcysteine, as we all know. Our next topic is iron poisoning. Clinical features will be there: nausea, vomiting, pain, multiple organ failure, PCT necrosis. Main complaint will be GI bleeding. So in question it will be written like GI necrosis, GI perforation, or GI bleeding. The main treatment, that is chelating agent, that is desferrioxamine. Our next topic is lead poisoning. So clinical features, first will be anemia and basophilic stippling, Burton's line, colicky pain, corpophyrin in urine, and drop like wrist drop and foot drop, and facial pallor, encephalopathy. These symptoms will be there. These all symptoms are very important. You should be through with it. Treatment for lead poisoning is basically EDTA, that is also a chelating agent. Another one small topic is alkaline diuresis. So in what drugs, in what poisoning we do alkaline diuresis, that we can remember by camp. So these are the 4 drugs or toxin, whatever you say. So these are the 4 drugs in which you have to do alkaline diuresis. First is chlorpropamide, second is aspirin, third is methotrexate, and phenobarbital. They will be asking you about alkaline diuresis, or they will be asking about acidic diuresis. You just have to remember these 4 drugs for alkaline diuresis. So as I said earlier, that we will be solving some PYQs. Our first question is: most industrial workers are exposed to lead as an occupational hazard. Which of the following statements regarding lead poisoning are correct? As we know, lead poisoning is also called plumbage, of course. Basophilic stippling of red blood is seen. Yes, that we have studied. Progressive massive fibrosis of lungs is seen. No, we haven't studied. And corpopurifin in urine, that is also we have seen. So we only know 1, 2, and 4 is correct. So the answer will be 1, 2, and 4. Our next question: all of the following features are present in organophosphorus poisoning except. So bronchiuria we know, we have studied, and confusion we can guess. So hypertonia and fasciculation, this I haven't told you. So for these type of questions, you should not be like get panicked. Most of the questions you will be able to solve, but 1 or 2 questions will be there that will be on the new concept. Okay, so hypertonia and fasciculations we don't know, but answer here is hypertonia. So some of the things and some of the questions you will have to just remember. Next question is small sized pupils seen in except. So O2P2 we know, organophosphorus compounds, okay. Opioids you will be seeing, and clonidine and cocaine. Here also you will have to remember that cocaine causes mydriasis. So answer will be cocaine. Next question. Child snake bite, petechiae and ecchymosis. That is, as we know that these are vasculotoxic symptoms, bleeding from venipuncture site and oliguria. So most likely snake. Vasculotoxic, V4 vasculotoxic, V4 viperidae, V4 viper. So one viper is there, pit viper. Next question. In a child with acute organophosphorus poisoning, OP poisoning, following drugs will act as anti-cyalagogue and peripheral parasympathetic drug. So we know there are only two drugs, atropine and oxymes. So atropine helps in symptoms and oxyme help in regeneration of enzyme. So here answer will be atropine. Next question. 4-year-old child, history of ingestion on 1 gram of paracetamol. What should be the initial management? Okay, 2 hours back. So as we know, initial management, we should do gastric lavage. The antidote is N-acetylcysteine, but if it is if the patient is coming within 4 hours, then you should do gastric lavage. Next question. A young female of 22 years old presented to medical emergency with complaints of nausea, vomiting, abdominal pain, diarrhea and convulsions along with methemoglobinemia. So this you will have to remember. This is the direct question. This is like it came for the first time. The answer is copper sulfate. While analyzing PYQs, I remembered it by, like, as we know, as we have studied in our chemistry classes, if you remember or not, I don't know, but copper sulfate is mainly blue. So I remembered, like, methemoglobin is also blue, like that. As I said, some things you will have to remember. There, like, you should not find concept behind every question, otherwise it will take a lot of time. Next question regarding elapid bite. Okay, as we know, elapid are sea snake and cobra and krait. These are our elapids. Okay, they are mainly neurotoxic. Sea snake is myotoxic. Okay, so question: regardless of the anatomic site of bite, walking of victim should be discouraged. Yes. Pressure immobilization should be used wherever possible. Okay. Ptosis can be present after the elapid bite. Okay, it can, because these are neurotoxic and myotoxic. So all statements should be correct. Our next question is urinary alkalinization. So we know we have the mnemonic, that is CAMP. Okay. So in chlorpropamide, aspirin, methotrexate and phenobarbital, we do alkaline diuresis. Okay. So in the question, phenobarbital is there, so our answer will be phenobarbital. Next question is early hypotension in venomous snake bite is due to which of the following? Okay, this question you will have to remember. This topic, I don't think that it will come repetitively. So the main mechanism of hypotension is loss of intravascular volume into the soft tissue. Our next question is gastric aspiration and lavage contraindicated. Okay, there are 4 C's which are contraindicated. First C is corrosive, second one is convulsant, third comatose and fourth kerosene. So corrosives are strong acid or alkali, and one is kerosene and petroleum. So again back to the question. First option is strong acid, yes, contraindicated. Alkali, yes, contraindicated. Petroleum distillates and kerosene, contraindicated. So our answer should be 1, 2, 3, and ethanol we don't know, so just skip ethanol 1, 2 and 3. But we can do this gastric aspiration lavage in alcohol. Next question is acetylcysteine is antidote for which poison? Very easy question, paracetamol. Next question, which one of the following drugs is the antidote for benzodiazepine poisoning? Okay, just read it and remember it. Okay. Next thing is, in a child with acute OP poisoning, which one of the following drugs will act as anti-cyalagogue and peripheral thing? I think I have repeated this question. Answer is atropine. Next question. An 8-year-old child has consumed a few tablets of a drug that were being taken by his mother on a regular basis. Following this, the child develops gastric necrosis. Okay, necrosis we have studied somewhere. Acidosis, shock, and hepatic necrosis, that is multiple organ failure. Mother taking on a regular basis. Okay, it can be multivitamin, calcium carbonate, folic acid, and iron. But if we consider gastric necrosis, then we know that iron can cause gastric necrosis, perforation, bleeding. Our next question: which of the following is not a priority in the initial management of shock from venomous snake? Okay, not a priority. Aggressive volume resuscitation, yes, we should do. Vasopressor support, I don't know. Anti-venom administration, yes, we do. All of these are undertaken simultaneously. Okay, so vasopressor support, we should not give vasopressor support because it increases peripheral vascular return, which can further lead to spread of toxic substance all over the body. So answer will be B, vasopressor support. We should not give the vasopressor support initially. It is just like as we do not advise patient to walk or mobilize, because it will increase to peripheral it will lead to increase in the peripheral vascular return, which further lead to spread of toxin. Next question: an 18-year-old boy was brought to the emergency department after being bitten by a saw-scaled viper. Okay, we see V, that is V, vasculotoxic. Okay, and then which is the most crucial in the patient? We have studied that in a vasculotoxic snake bite, we do 20 WBCT, and in neurotoxic we do single breath hold count. Okay, so in this question they are asking about viper, that is vasculotoxic. What we should do in vasculotoxic, we should do 20-minute whole blood clotting test. Next question: bite of cobra is likely to result in flaccid paralysis, coagulopathy, myolysis, cardiotoxicity. Cobra, okay, cobra, krat, these are your neurotoxic drugs, neurotoxic snakes. Okay, so they will lead to paralysis. So answer will be your flaccid paralysis. Another ellipid is sea snake, which leads to myolysis, but here they are asking about cobra, so answer will be A, flaccid paralysis only. Our next question is: which of the following toxidromes is associated with the consumption of pesticide containing organophosphates? We have studied that organophosphate and carbomates causes increased cholinergic activity, so answer will be cholinergic. Next, which of the following is the primary antidote used in children with organophosphate poisoning? OP poisoning antidote, we know that is atropine. Answer A. Next, this is an interesting one. Following the bite of a snake, patient develops generalized myalgias, rhabdomyolysis, and progressive flaccid paralysis. The most likely implicated is, okay, flaccid paralysis. It can be neurotoxic. It can be due to myotoxic snake, but it cannot be due to vasculotoxic. So we are excluding vipers here, but cobra, krat, and sea snake, these are our elapids. But cobra and krat, these both are neurotoxic. They can cause flaccid paralysis. Russell viper can't. And sea snake, this is also an elapid. It can also cause flaccid paralysis. Okay, but myalgias and rhabdomyolysis, these are indicating toward musculotoxic, myotoxic snake. So answer here will be sea snake, which is the only snake we have studied is musculotoxic. Our next question is: gastric lavage is contraindicated in which of the following? Corrosive, yes, it is contraindicated. Organophosphates, okay, wait, and intoxication and turpentine oil ingestion. Okay, we know about corrosive. We can also guess that turpentine oil, it is related to petroleum. So petroleum and kerosene, that we studied in 4C. Fourth one was kerosene and other petroleum products. So answer will be 1 and 4 here. Answer will be D. Next question. Child after snake bite develops petechian decumosis, indicating towards the vasculotoxic snake. In addition, child develops bleeding from venipuncture site and oliguria. Answer, pit viper. Next question is, child is brought with history of ingestion of unknown substance. Okay. On examination, child has excess salivation, lacrimation, meiosis, gastrointestinal cramps and emesis. Excessive salivation, excessive secretions. Okay. Meiosis, that is pinpoint pupil. Now you guess, what can be the answer? Carbamate, phenothiazine, opioid and tricycline. We have studied these two symptoms are strongly indicating towards OP and carbamate poisoning. Answer will be A, carbamate here. So I have tried to teach you those topics which are coming repeatedly, and also tried to give you some PYQ and their answers. So I hope it will help you in your studies for UPSC CMS. With this, I would like to say thank you, and if you have stayed here till here, then you will be at least marking 75% questions right. If you want any other specific topic which I should cover, you need any help in any specific topic, please let me know. Until then, thank you. Bye bye. Focus on your